Okay, so we're going to look at EKG interpretation a little bit. I just wanted to show you this. Do you see in here how we were talking about right deflection and how the deflection goes up and down, and this is a picture of that. Okay, this is a picture of that. So this is how you do an EKG. So the one that Ms. Spear probably does more often, and I could be wrong, is the 12 lead EKG. These take all different kinds of pictures of the heart in terms of looking at the electrical impulse, because the electrical impulse tells us which parts of the heart are working. There's a very, very specific way that they look, and this 12 lead is much, much more detailed than the 5 lead. The 5 lead is what I used in the PACU and in pre-op, and they use in the OR. They don't use a 12 lead in the OR. If they need a 12 lead, they'll just go tell somebody to get the 12 lead and they'll hook them up. But this says that there's a memory trick included. Here's the memory trick that we used. So the white is right, and that's snow over trees, smoke over fire, and chocolate close to your heart. That's the one that we use. Okay, so this is a picture of ventricular tachycardia, and you can't see the P waves because it's going so fast. Now, some people, this is a lethal rhythm. They become unresponsive, unconscious, and stop breathing. Some people, and I've seen them with ventricular tachycardia, actually are awake, but they're not feeling very good. Their heart is going too fast. It's not filling enough, and not enough oxygen is getting to their brain. This can quickly go into a lethal rhythm. This is supraventricular tachycardia. So remember when I said the electronic pulse goes from the SA node through the AV node and it slows the roll? So this is when the AV node's not slowing the roll. The atria have a fast pace, but the AV node slows it down because the ventricles, you want them to be able to get a good squeeze. You don't want them going so fast that you don't get that good squeeze, because if you don't get the good squeeze, the blood doesn't go through the aorta to the brain or the rest of the body. You feel weak, you feel dizzy. So it's characterized by a heartbeat going at least 150 beats per minute. It's a very spiky QRS, so it's very, very narrow, and you can't see the P waves because they're going so fast. When you see atrial tachycardia, it kind of can look like this, but it's much slower. Atrial tachycardia might be, 100, 110 to 130 beats per minute. This is supraventricular tachycardia, and it's at least 150. This is ventricular fibrillation. This is a completely disorganized rhythm. Nobody's getting any blood. This is a lethal rhythm. If you don't shock this rhythm and get it restarted, that patient will die. This is asystole. This is called flatlining. You can't shock this rhythm. You just try medications and hopefully it'll come back. Most of the patients I've seen that go into asystole do not come back. First degree AV block, and that's a widening of the QRS due to a slower impulse. So when the P wave goes, the atrial goes, it slows down too much, and the QRS gets the P to QRS gets wider. So that electrical impulse from the SE node is not going fast enough. And this, you can live with this. This is not a big deal. This is second degree block, type 1. So they used to call this Mobitz, then it was Winky block. Now they're just calling it secondary AV block type 1. So AV is the atrial ventricular node. And what happens is the electrical pulse goes and it's normal. And then the next time it goes, it'll be slower. So the P to QRS is much longer. And then it's very, very long. And then it can go back to normal. And it just keeps doing that. It goes normal, then longer, then longer, then normal, then longer, then longer. This one is a normal piece. Like if you were to try to measure these, they would measure perfectly, but they drop the QRS. For some reason, the AV blocks the impulse, and there's no ventricular contraction. This one is when there's no correlation between the P's and the QRSs. Each new node, AV node and SA node, they're doing their own thing. They're not talking to each other. There's no conduction. This can be a lethal rhythm in some people. I have seen people have to come into the hospital with this. They're not feeling very well, and they have to put pacing pads. So they use the monitors, and they put, instead of shocking, they put one pad on the front, one pad on the back, and they use a shock to shock your heart and pace it. A person like this would probably need a pacemaker put in. Okay, and then the last thing we're going to talk about is the leading cause of death for both men and women in the United States is heart disease. And that's because of the food that we eat, a lot of it. We eat food that's not good for us. We don't get enough exercise. There can be family history of heart disease. There can be racial or ethnic problems with your heart, high blood pressure, high cholesterol. All of those things can damage your heart and cause a problem. So to lower the risk of heart disease, you have to prevent the problem. So for instance, prevention, and one of the biggest factors is control of high cholesterol levels and triglycerides. So you have two different kinds of cholesterol. Well, there's three, but one of them we're not going to worry about. So there's LDL, and this carries newly formed cholesterol from the liver to your tissues. This is a bad one. Okay, LDL is bad because when it's carrying this cholesterol that's formed in the liver to your vessels, it's blocking your vessels. Okay, that's what causes the problem. HDL is the good cholesterol, and it takes the cholesterol from the tissues and brings it to the liver to destroy. So you want to have low cholesterol. Okay, that means under 150. And then there's VLDL. This is the one that we don't really worry about. It's responsible for transport of fats and cholesterol through the blood. So if there's a lot of VLDL, you probably have a lot of triglycerides. That's fat. You don't want that in your blood. That can create a problem too. So your total cholesterol should be under 150. Your bad cholesterol, which is your LDL, should be under 100. And your HDL, which is your heavenly cholesterol, it should be over 40. Okay. Triglycerides should be under 150. Other prevention that you can use: lower your blood pressure with blood pressure medication. Lower your stress, that sometimes lowers your blood pressure. Prevent diabetes. You do that by weight and exercise. No smoking. Smoking is the worst thing you can do for your heart. Moderate alcohol use. So when you are old enough to drink, you shouldn't drink more than 2 a day. A healthy BMI is between 18 and 24.9. Regular exercise, 30 minutes a day. Diet and nutrition, lower salt intake, and less saturated fats. Saturated fats are the fats you get from meats. There's all kinds of conflicting information about what you can eat, what you can't eat, but here's the bottom line. Calories out have to be less than calories. Sorry, the bell just rang. So calories out have to be less than calories in. All right, guys, that's about it for conduction, and we'll be going over that in class. But make sure you take some notes, especially on the cholesterol, and I'll see you in the next one.